So this is our occupational health case study. It's going to be Melanie Milligan, which is myself, and also Lucy Fletcher. We are both nurses. So the introduction, the basics of occupational health nursing, practicing are to promote health and work and to protect the healthcare workers. The WHO reports that out of 35 million healthcare workers, about 2 million are exposed to infectious diseases each year. This is probably more, just being realistic in the world of being in that field, probably more just not reported. So our situation is that Katrina is a nurse and she presents to the occupational health clinic with a needle stick. It was an accidental needle stick in the OR where she performs her work daily. And the patient that they had was a known HIV patient. So she is now under the consideration of the potential of being exposed to HIV. So the pathophysiology of HIV is pretty extensive. The human immunodeficiency virus, which is HIV, pretty much is a self-attacking virus that attacks the immune system. The virus infects the hosts. It basically binds to the CD4 receptors, and the CD4 receptors are the ones that fight infectious disease within our bodies. Once the virus gets into the cell, it infects the inner cell of the cytoplasm, and it replicates itself, making it look like the human's own cells. It pretty much confuses its own cell, thinking that it's the same, but it's not. It's now the infected virus. So it destroys your CD4 counts once it overtakes the body. It lowers your CD4 count. The disease fights the cells, your own cells, and if not treated, it can destroy your immune system altogether, and it can lead to AIDS. So this is just a picture of the actual virus itself within the cell. It would take a real scientist to explain this, but I just thought it was interesting. So the background of our patient is that she's a 64-year-old nurse. She's been working in the OR for over 20 years. And her only history that she has is hypertension and high cholesterol, or hyperlipidemia. Her vital signs are stable. That's the assessment at this point. She's had a CBC and a BNP, which were all within normal ranges. The needle stick that she had on her left palmar has been washed and cleaned, and with soap and warm water, and they just put a Band-Aid over it. And she appears to be very nervous, and she verbalizes some fear of the worst case scenario, meaning she's pretty scared she could have obtained HIV. So the questions that it would present is, what do you expect the physician to order due to an accidental needle stick? And then also, what are the other physical injuries or psychological injuries that could have occurred or is currently occurring to the patient as their unsuspected possible outcome. So the physician has ordered post-exposure testing, which would be testing obviously for HIV. They would also test for hepatitis B and also for hepatitis C. They're going to order Comvivir, and it's going to be 1 tab twice a day for 4 weeks. And they will also potentially order a referral to a psychologist or any type of mental health counselor if needed. Our nursing interventions, we would complete the assessment of the patient, including the site exposure, ensure that the site has been appropriately washed, which it has, discuss the plan of care, including post-exposure prophylactic medications and potential side effects, and discuss post-exposure follow-up regimen, and also provide strategies for a coping mechanism. All of these would be helpful to someone who is facing the impact of the thought of obtaining HIV. Next will be Lucy.
Thanks so much, Melanie. It's now been 2 weeks since Katrina's occupational exposure via needle stick in the OR. She presents back to the occupational health clinic with complaints of fatigue and nausea. Here are some questions. What could we attribute to the cause of Katrina's nausea and fatigue? Is this normal after an occupational exposure via needle stick? And what supportive care could be given to Katrina at this time, especially to help cope with the symptoms that she's having? Let's discuss. Nausea and fatigue are actually common side effects of Combivir. Katrina should be told that these side effects are normal and the benefits of the medication certainly outweigh the risk of stopping it at this time. This is especially important as we know that the patient that she was stuck with the needle from was indeed HIV positive. Melanie's also already done a great job of explaining the pathophysiology of this disease, and so we know it's important that Katrina continue the Combivir in order to minimize her potential risk of transmission. At this time, we should include some supportive care for Katrina, including continued mental health counseling and referral to local support groups. Nursing interventions, therefore, should include education of the patient, in this case Katrina, on the side effects of medication, educate her in regards to the follow-up regimen, including how long she needs to continue to be on the medication, as well as her follow-up blood work, actively listen to her and encourage her to discuss her fears, and then also refer her to the support groups as well as pastoral care that we already talked about. So now let's fast forward a little bit. It's now 14 weeks since her exposure, and Katrina presents back to the Occupational Health Clinic for the results of her 12-week blood work follow-up. She's doing much better from a mental health perspective and notes that she has been seeking the advice of her pastor and has been going to church much more often. Let's talk about some questions during this phase. If Katrina's test result is now negative for HIV, HBV, HCV, will she need additional follow-up testing? And how should the occupational health nurse respond to Katrina's request to donate blood at her upcoming blood drive? Let's discuss. Katrina's blood work does indeed remain negative for HIV, HBV, and HCV. However, she must be told that she must receive additional blood work at the 6-month mark in order to confirm negative testing. At this point, with it only being 12 weeks out from her initial exposure, there is a potential that we could get a false negative report. So it is very important that she continue the follow-up regimen and complete it out with that 6-month recheck. She should also be advised not to donate blood until we have received those 6-month blood results. Of course, this is also because of what we just discussed, that we could potentially have a false negative at this time, and we would need to confirm that at her 6-month follow-up. So here's some nursing interventions for this phase. We should discuss the importance of the follow-up testing regimen. Obviously, if Katrina had asked a question in regards to the blood drive, she may not have fully understood what we originally told her in regards to the blood work timeline that she would need. We should also discuss strategies to minimize potential exposure to others. This goes along with the blood drive question, because if she did donate blood and they accepted it, unaware of the fact that she could still be HIV positive, then she has the risk of transmitting the HIV to others if indeed she were positive. We should encourage Katrina to continue the mental health counseling and also to continue to seek support from her pastor in her church. That seems to have been doing a really good job for Katrina, since she, in a mental health capacity, is coping much more better at this point. So let's discuss the final outcome. It's now 6 months after Katrina's needle stick injury, and she's relieved to find that her final follow-up blood work remains negative for HIV. This is obviously the best outcome possible for Katrina. It was good that she continued to follow the follow-up guidelines that we set forth in the beginning of this discussion. And at this time, she would not require any additional follow-up. She can return to her normal daily life, knowing that she is indeed HIV negative and that the needle stick injury didn't compromise her status at all. Here are some references that we used during our presentation, and Melanie and I would like to thank you for your attention.